started. We may have a few more people come in, but I want to welcome you all to our panel here at the Smart Cities Tech Jam, opening up a dialogue on environmental health and equity. Our goals are very explicit. We do want to open up a dialogue on various topics, so I think I see our role here as raising interesting, juicy questions, not necessarily having all the answers, and maybe speaking for voices that are not represented here at this particular meeting who may be affected by these changes. The big picture for this meeting, we have a lot of time. We probably won't necessarily go the whole time that we have allotted, but what we could do today, we certainly have a good hour and a half sense of content here. I'll get things going in a minute on some general intro. We'll have some panelists talking from their various areas of expertise. Unfortunately, one of our panelists had a biking accident and is not going to be able to be here, but I'll try to summarize a bit of his research because it's really important. And we have a small enough group, so in a moment I'm going to have everybody introduce yourselves and see how other people can contribute here. And after our panelists and whatever else that other people want to add, we'll have some Q&A and then make time for a break at 10:15. And then we do have another section which we could go deeper if there's interest in some exercises in scenario planning and things like that. One interest, though, is finding out if there is a critical mass for people wanting to make this an official smart cities topic, what we call a supercluster. So there's a lot of, if people are interested in this area, I think this is like a ground floor time to jump in. So at the very least, we're going to want to collect names of people that are interested and just keep that going. And then we'll see who else might pop in. We have just the three of our panelists today. For myself, Thomas Doherty, I'm a psychologist. I'm based here in Portland, Oregon. I'm originally from Western New York. Buffalo, New York is where I grew up. My background in psychology is interesting in that I did outdoor work before I became a psychologist, so I had a background in outdoor therapy, wilderness therapy. So I brought that interest into psychology, and that led me to study the psychology of people's connections with nature and the natural world, how the natural world is good for our mental health. And I also worked in hospitals and medical settings, so I've integrated some of the health psychology work into that. And where that's taken me recently, for several years, I ran a certificate program for mental health counselors to teach them how to do outdoor therapy. I've also been involved with the American Psychological Association's Climate Change Task Force, so I've been doing research and work on climate change and mental health impacts of climate change, and publishing in the area of nature and mental health and outdoor therapy and things like that. And more recently, technology has been an interest of mine. I actually went back and did some code school training, and I've been integrating into technology a little bit. So I think this is really a fascinating area, and it's a way to get ahead of the curve, I think, on massive changes that are happening in our society. And I'll let the other panelists give a little background when they come up. Jeff Donovan is not able to be here. He's the person who had the biking accident, but he does fascinating research on trees and human health. And it's really kind of mind-blowing research, so I'm sorry he's not here. I will have a slide to give you some examples. But for example, he studied the relationship between tree cover in a neighborhood and basic aspects of human health, such as the birth weight of babies born in that neighborhood. Tree cover and birth weight of babies is related. Or when invasive species like an insect will come in and destroy tree cover in a region, how that affects the cardiovascular health of people in that region. So his research speaks to these really deep connections between human health and the health of the natural environment, which underlies a lot of our work. And I'll let David and Elizabeth speak to their backgrounds here in a moment. But just to start us off, I want to go around. We have a small group, so I want to just go around. I'd like, if you don't mind, if you could just introduce yourself, where you're from, maybe a little bit about what you're doing and what's bringing you into this meeting. That would be helpful because we do want this to be a dialogue. Hello, come on in. We're just getting started. Would mind starting off, saying a little bit about who you are, where you're from?
Sure. Hi, I'm Megan Manley. I'm from the MITRE Corporation. We're a federally funded research and development center supporting the Department of Homeland Security. That's a lot. So we're, on behalf of DHS, we're looking into how they can help, especially local governments, make sure that cybersecurity is part of the conversation. I'm especially interested in this topic, though. I come from Charleston, South Carolina. There's a lot of history there in equity. I am also really personally vested in this. I'm hearing impaired, member of the Hearing Loss Association of America, and having to fight like crazy locally to make sure that that we're not only following the law, but there's a lot of modern technology that can make life so much easier and not be intrusive and not make us stick out like sore thumbs or look like we're sitting there listening to iPods when really we're just trying to hear. So,
Well, thank you. That's really, I know this is going to be a great, interesting group, I can tell.
Can you hear this conversation okay?
Yeah.
I can, thank you.
Okay.
Yes.
But if I start fiddling on my phone, I swear.
Thank you. Charlotte, you want to call?
Yeah, hi, my name is Charlotte Seto. I'm based out in Washington, D.C. right now, and I work for the National Fair Housing Alliance. So I specifically look at how we can affirmatively further fair housing and desegregate housing, which feeds directly into equity. I would love to transition that knowledge into the smart city sphere.
Great, thanks.
Hi, I'm Monica Wright. I live in Portland. I work for an engineering firm called Jacobs, and I am an atmospheric chemist. My doctorate was in designing an instrument to measure differences between emissions from diesel and biodiesel. We were using VW Jettas. It was really quite interesting because some of the work that we were doing was pre, hey, wait a minute, the emissions and what's actually, what the engine computers are saying don't line up. So I've always been, before I did any of the work that I do now, I was a high school teacher for 8 years. So I've always had a different view than most of my colleagues on why I do the work that I do. So I really come at the environmental work from the standpoint that all of the regulations have been created, because, especially in the US, they're created because of a problem that actually happened. So the regulations are based in a tragedy, some kind of event that harmed people. And so when we're working with industry or cities to try to meet those regulations, we really are working on protecting human health. And so sometimes bringing it back to that, we're all there at the table for the same common reason, and that those humans could be the employees of the facility, they could be the neighbors of the facility, they could be the constituents of the government, but those humans all have an equal right to an environment that's not harming them and more than what's reasonable. And so that's why I'm in the work that I do. It's not always popular, but I'm really interested in how we can use technology and planning and really like what kinds of things are we going to measure and how do we evaluate where we are and if our plans are actually working.
Thank you. This is all really fascinating. I want to hear from at least a few more people about who they are, who they are, and why they're here. Would you like to share?
Hi, good morning. My name is Brigitte Pineski. I'm a primary care physician who began in Canada and did my training in the first 10 years up there. Coming to the U.S., I was really shocked with the health inequity, and so that kind of pushed me out of primary care, seeing patients one by one, and became involved in medical administration. Spent 10 years with Peace Health as their chief medical officer for the lab, looking at technologies to enable the smart household, the smartphone, and really found that it was obviously incredibly difficult to change the beast from inside because the business model was so against us. And so for the last couple of years, I've been outside of healthcare helping startups and hopefully become successful with their business models in healthcare, and more importantly, really invest in educating investors. So with Oregon Angel Fund and Tide Oregon, helping investors understand what needs to happen and why. And more recently, very much focused on blockchain as a new technology to allow us to finally stop talking about transformation and provide concrete and solid projects that will be very transformative.
Excellent. All of you could have been on our panel, so this is really great. I do want to touch on everyone, just in the interest of time. We'll speed it up a little bit. Just you can say your name, where you're from, and just one bullet point about what's bringing you in today. I want to get a sense of the expertise in the room, and we will have. There's a whole section where we can talk some more. Can we just do a little more of a pass through of everyone to make sure we get the names and some key points? Would you like to follow up?
Okay, I'm Stan Curtis. I'm with Urban Systems, and my background is engineering and math, and my interest in these topics, personal from some experience, but especially as a statistician, how to lie to statistics is the thing that's meant as a topic, and it's well published by Inequities in 2005. That the sad news about healthcare is most of the stuff is not well founded. So I'm very interested in sort of how that will come out. And my kids were born in Boston. I know what it's going to like.
Lynn Merrick, citizen Portland, and involved in the community on the steering committee of Let's Talk Climate, free and open to the public forums on climate mitigation and policy, both in the city, statewide. Very interested and concerned that the solutions of today don't become the problems of tomorrow. So trying to get a handle on how smart city, on how, who's keeping track of, is it really going to bring down our emissions and work to help us with the climate change issue.
Excellent.
Hi, I'm Lisa Scooby. I am here reporting, but I'm also working with Mobility Cube and Urban Systems. My background is in communication and narrative architecture, responsive engagement design. I'm really interested in models like health and wellness and their association with leading cities and how citizens relate to that. The intertwined being here today, I'm very excited about that. They have some really interesting use case, I think, related to that, and would love to have anyone who's here today check in with me if there's some things that you see specific to wellness and its connections to smart cities. I'd love to hear more from you and what you think of that promise and that opportunity. I am recording today, but I think they are anyway. So I just wanted to let you know, and nothing is going to be used other than for scratch track to be able to source things correctly.
Okay, fair enough. Yeah.
I'm Marjorie Lyman. I'm actually a historian by doctoral training, but I am a partner in a consulting firm, and while I am here for a project that we're working on with PAC Oregon, it's an education project, and I'm interested in local transportation as well, because we have another client. I have yet a third client, which is the village. I don't know if you people know the village movement, the aging, but the local village in Washington has 13 villages and has a council of villages. And I have for a client the Waterfront Village, one of the largest villages in the city of Washington, D.C. And they have very real concerns about equity for elderly people, the increasing percentage of the population. And they're rarely addressed because their equity issues are often equated with racial issues or with poverty issues rather than with middle class, limited income issues, which is characteristic of a large swath of the senior population. So I come here to hear about it, and I'll bring it back to them.
Excellent. This is great. Sir, in the back there.
My name is William Roy. I'm here with Eagle Landing, which is an urban suburban city, 2.1 million square feet, that's being built. 10 years in planning, got final approval, and I work on the side of mobility.
I'm sorry, where is it being built?
On the shoulder of Mount Scott, at the end of the green line,
Oh, okay.
the old top of Scott Golf Course.
Eagle Landing. So,
So I'm the owner of the project. I've been 25 years into the project, 150 acres of land, working in the last 33 acres of 2.1 million square feet high density urban suburban market. But we consider ourselves a petri dish for some of the stuff that you're talking about, IT and AI and community and how it all works together. You know, recognizing that you can't just cram things together without being able to address the community issues about livability and how that interacts with people and how people can interact with each other. So that's why we're here.
Excellent. I'm really so glad you're all here. This is such a great group.
This is going to be so fun.
Yeah. So for people that had come in just recently, just to remind you, so we have a lot of time for this morning. We do have good content through about 10:30 of panelist talks and this dialogue here. We do have other time if people are interested in staying into the second session to do some group exercises and planning. And there is an interest in who wants to move forward in this kind of work in terms of the Smart Cities initiatives here. So I want to get names of people that are interested in staying connected about this. Well, let's keep moving here. Just to get us going, I wanted to call out some what I think are obvious and then maybe not so obvious questions and points that could underlie our discussion today. Obviously, we want to look at what are the health benefits of Smart Cities technologies. How does it improve human health? And also the co-benefits, right? And that's a public health term, but that's sort of the extra bonus benefits, I guess, that you wouldn't necessarily think about when you have a light rail system that might help with emissions and crowding, but it also might encourage people to walk more and increase cardiovascular health. So there are co-benefits of these kind of technologies. And what are the needs of different groups and across the lifespan, from infancy to elderhood? And what are the consequences, both known and unintended? I think it's important that we admit that there are going to be consequences in advance and not, that's the best way to try to limit the unintended ones, because none of this technology is obviously benign. And then how do we educate people and build support for these initiatives, including people's fear of these initiatives and their reluctance to take on these technology things? You know, if you've been here in the last couple of days, you know, there's a lot of interesting philosophical questions underlying these technologies, and questions of safety, and questions of autonomy, and privacy, and things like that. And then how to partner with existing groups rather than trying to reinvent the wheel or reinvent the autonomous wheel. You know, there's a lot of people here in Portland doing a lot of things for health and equity and for the environment, and how do we bring people together and avoid a silo situation. Then there's some deeper questions. I mean, my personal interest is the psychology of this. What are people's beliefs about nature and technology, and how do we start to surface that? People have if you talk to people, they have very clear ideas about nature and value of nature and the relationship with nature in the natural world. They have very clear ideas about technology, but they often don't get a chance to talk about these things, and they don't get a chance to express them. So they need some coaching in that regard. But I think if we don't get at some of the underlying values and beliefs, then we bump on surface issues, but we don't really get at the core things. And then how do we honor these differences? And then what are the implications for health disparities and inequities? A disparity is simply a difference in health between two groups, and inequity is something that seems to be unfair or changeable, right? So there's a moral aspect to this work. How do we address what's called, what sociologists would call durable inequalities, right? If that's a term you haven't heard, it's a really fascinating one. A durable inequality is an inequality that sticks around no matter what, right? So the advent of the steam engine or the telegraph or the automobile or the internet did not erase inequality or poverty, right? There are certain forms due to structural inequalities and due to class issues that keep certain groups unequal. And so a new technology won't obviously change that. It might just perpetuate things. So how do we keep that question in our mind? And then maybe as far afield as we're going to go is what are the implications for nature and other species? What are the rights of nature and other species? I heard a lot of fascinating things yesterday, but I don't think I specifically heard anyone take what I would call an ecocentric approach. All the talks yesterday I heard were anthropocentric, they were human-centered. They were about humans as being in charge of the planet and as being on top of the pyramid. I didn't hear any native voices, for example. I didn't hear people thinking about humans as just part of the larger circle of life. So how do we start to think about that in this kind of arena? And then ultimately, are we building, as I said, an ecotopia or a gated community? An ecotopia, if you aren't familiar, was a novel that was written in the 70s about Northern California, Oregon, and Washington seceded from the United States and created their own ecological country. Right? It's a fascinating novel, very prescient. They did all kinds of wild things like use recycle bins and tear up roads and create walkable neighborhoods and talk on little speaker devices and things like that. And they really tried to make a steady state economy that linked urban centers with the wilderness in the Northwest and existing places here in the Northwest. So are we going toward this, or is it some sort of gated community or some sort of dystopia? Right? Some interesting questions. Another way to think about this is what would be the view of our talks from Eastern Oregon? Right, we're in a bit of a bubble here in Portland. I just found that I Googled Eastern Oregon pictures and this one came up and I thought it was kind of evocative of a different part of the state that might be more focused on space and personal autonomy and rugged individualism and tradition and history and patriotism and things like this. How will our talk play for that crowd, and how can we be connecting? And then more closer, how is this going to play in East Portland, right? How is it going to play in the neighborhood that have been disparities, the Felony Flats neighborhood, the neighborhoods that people have been displaced from the central city, right? How do we link all this stuff up? So this is kind of where we get into the local justice and diversity stuff. These are some other juicy questions. And this is a disruption. Kevin Martin spoke yesterday. He's a smart cities manager here in Portland, and he talked about Portland's main investment in smart cities is about dealing with inequity. And he said this is Portland's disruption in the sense of new technology disrupts existing patterns. Well, this is Portland's way of disrupting new technology, I guess you could say. So we have a lot of support for this here locally. A couple other quick things before we get going. Well, what is health? Realizing that when we think about health, health is a number of things. It's the absence of illness, but it's also the presence of well-being and positive aspects of life, right? And in health, if you've ever worked in healthcare, there's a difference between health outcomes and health satisfaction. An outcome is actually what physically happens with someone. Satisfaction is how they feel about their treatment and how they've been and have they been treated with dignity. You could work with someone who's terminally ill, and they're not going to have a good outcome, but they might be very satisfied with how you work with them. Right? So thinking about those things, and they're not the same. And then health is being influenced by the environment in ways we're still trying to grasp, and that brings us up to Jeff Dunham's work. I'm sorry he can't be here. I spoke a bit about him earlier. He's a researcher for the Forest Service, but his studies have shown that large-scale environmental changes, such as the decrease in tree cover after there's an insect called the emerald ash borer, and it got into the trees and killed off tree cover in places in the northern U.S. And as the tree cover went down, the rates of cardiovascular illness go up in the region. He also studied tree cover in neighborhoods and the health and birth rate of babies. Right. So the environment and the natural world does affect our physical health in a lot of ways we're still trying to understand. So trees aren't just pretty. They have ecosystem services. They affect crime rates. They affect people's satisfaction. Greenery in neighborhoods even affects people's sense of possibility for the future. There's all kinds of psychological aspects of this work. So it's just fascinating stuff. So we're going to get to our panelists. I was going to start with Elizabeth, and she's going to talk about her work with aging populations, and I'm going to get her slides up here.
Should I hand around a sheet of paper and just have people put down a name and email?
That'd be great.
If they would like to.
That would be great.
Would you guys be up for that? Okay, well, I kind of feel, I'm going to use the mic. My voice isn't very loud. I'm always getting that up. Let me see if I can.
So there's a little tethering. Thanks, perfect. There's a little mic tethering, but I figured it'll just be easier for everybody to hear me. Is that better? Is that okay? All right, good. Thank you. All right, I'm Elizabeth Backstrom. I am a geriatrician. I take care of older patients. I'm at OHSU. I run the geriatrics program up there, and we do work in the outpatient clinic, the hospital, and also in a couple of long-term care places here in Portland. So I'm pretty embedded in the world of doctoring, like you used to be. But I also am really trying to think about how we can leverage what we know in medicine to really get to health on a broader perspective and really think about population health. So I'm here today. I don't have any answers. In fact, you guys sound amazing, and maybe by the end of this session, you're going to have some answers for me on how to really, have healthy aging and ability to age well. And it's funny. We kind of think of this notion of health as the absence of disease, and that was, kind of the first definition. But the way I like to look at it, and when we think about older adults, it's almost impossible to completely avoid any chronic conditions. It's not our fault if we get cancer. These things happen to us. We're hit by the bus, right? But it doesn't mean we still can't have health, because we might be living with chronic disease, or we might be living with a mental health issue, or we might be living with something that makes us, kind of not perfectly healthy in the narrow aspect of what health means. But we can still thrive. We can adapt. We can live in our environment in a way that allows us to have the highest possible quality of life. And I think that's what we're going for when we say healthy aging, or when we say aging well, or when we use these terms. It's not necessarily that we live in a way to avoid any illness, but that whatever comes our way, we're able to adapt, we're able to thrive, we're able to make sure that we are still have the best ability to have optimal health. Does that make sense? Okay. Who has heard of age-friendly cities? A couple people. Good. All right. So Portland was the first age-friendly city. So age-friendly cities, started with the World Health Organization, and so it's an international mantra, and there are somewhere close to 50, I believe, kind of age-friendly cities around the world. Portland and then New York City was the second one in the U.S., and now AARP has taken a leading role in growing age-friendly communities within the U.S. So you can kind of look to AARP as a person that's helping to lead and helping communities become age-friendly. We've had this designation, I want to say since about 2007, quite a long time. And we are working to maintain it. As you can see, our current mayor, Ted Wheeler, wants to continue to lead the nation as an age-friendly city. Apparently, Los Angeles is trying hard to beat us out and be more age-friendly, but Ted says we're going to stay ahead. So these are things that you are all aware of. You guys work in each of these areas and in all of these areas. And really, I think it speaks to the fact that health is a part of having an age-friendly city, but it's really not even the key determinant. When we're talking about what makes older adults thrive, we're talking about all of these things, including respect and social inclusion. I'm so glad that Portland has taken an equity lens in everything that we do, because it's so important. The community supports communication and information, outdoor spaces and buildings we'll talk about today. All of these things are part of what allows us to have age-friendly cities, okay? And there's also a newer notion called an age-friendly health system, which I'm not going to talk about today, but I also think that's kind of an interesting new development over the last few years. An age-friendly health system is one that wherever an older adult touches the health system, they touch a team who's competent in caring for older adults, who has some extra skills and practice around being sure that they can speak to the needs of older adults. And they have 4 key mantras, and they call them the 4 M's, and I think they're really good. And those 4 M's are medications, so making sure that older adults aren't taking too many pills, or pills that are risky, that can cause falls, that can cause dementia, that can cause problems that a lot of primary care doctors may not even be aware of because we didn't have that good of training when we went through medical school. Medications, mobility, which is just kind of your ability to get around in your community, do the things that you need to do, and do them successfully, not have a high incidence of falls, those kinds of things. Mentation, maintaining the highest level of cognitive tasks that you possibly can, attending to mental health issues. And then the 4th one is what matters, and this is a particularly important one. This is goal setting and really thinking together with older adults at an individual and at a community level about what goals are. And I think the Village movement has been really good about this. They really try to think about what it means to age in place and what people's goals are for that. And just understanding what people care about most is highly important, and a lot of us are not all that good at addressing it in the medical system. So I think we're working on getting better. These are the determinants of active aging as developed by the World Health Organization. That's why you'll see aging spelled with an E, international terminology. But again, these are the things that you guys are working on every day and that really fit together to ensure that older adults can age well. And I love this model. You know, it's their physical environment, it's their social determinants, it's behavioral determinants, all of these things that fit together to ensure that someone can have active aging. Feel free to interrupt me, by the way, as we go along here. I think we'll have lots of time for discussion, but I want to make sure that you feel you can ask questions or maybe tell a story along the way. Okay, so this is how Portland is doing. This is AARP, who's put together this Livability Index, livability score that you can look up for your city. I should have done Washington, D.C. We've got a couple people here from Washington. I don't know what your livability index is. The Oregon Convention Center we're being asked to choose a Wi-Fi plan. Okay. Has anyone seen this before, the Livability Index? It's kind of new. So we got a 61. We're not super in the green zone, but and I looked up a few other cities, although I might have been a little too West Coast centric. Seattle is 62, so they beat us out by 1 point. San Francisco is 64. LA got, guess what LA got? 51. Not too bad, but lower than us. Yeah.
You said this is by the AARP?
AARP. So you can just, if you Google AARP Livability Index, you can look it up for your town. I mean, you could look it up, we could look it up right now, except for we just turned off the Wi-Fi on this computer. And Chicago, I think, got a 53. So, scores aren't that great. I should have checked New York and DC, but this, I think it's a nice way of kind of thinking about the broader context of community living and spaces. And you can see here for Portland, we're actually doing really well in transportation, or pretty well. I don't know if 78 is really well. And we're doing pretty well in community engagement, civic and social involvement. So we got pretty good scores in some things, but look at this 44 in opportunity. This is kind of the ability of older adults to have new opportunities, to maybe have encore careers or stay in the workforce until they're a little bit older and really be able to succeed as we age. Anyone have any? Yeah, please.
So I'm just wondering, do you know what the feedback mechanism is here? Because this is obviously a rules-based score.
Yes.
Right? Commissioners went in and said, these are the rules,
Yep,
so
yep.
this is how we're going to score.
Yeah.
Is there a way of feeding back the actual experience of the livability system to update and correct the score?
Yeah, that's a great question. It's pretty new, so I don't know that they've really worked on that side of things yet, but that is a great question, because you would want to have response,
Right.
from the various communities that says, wait a minute, you guys didn't think about this.
Right.
Or,
We underweighted this.
Yeah, exactly. So I don't, my sense is that hasn't happened yet, but it's fairly new. So I bet that AARP would love to get feedback from people and, kind of see where people how people are about agreeing or disagreeing with some of these numbers. So yeah, it's kind of an interesting new tool that we could start to use, and I think start to leverage. I mean, we can go back to the mayor's office and say, hey, we're not doing that well in opportunity. Is there something that that we can do as a city to make improvements there? I think this is pretty interesting.
And that's a great place for elders to act as citizen scientists.
Absolutely.
Create more and more data about their experience.
I totally agree with you.
Back into the score.
Yeah, I totally agree with you. And actually, that would be a really fun thing to talk with the AARP about, right? Is to how to think about using our older adults in the community to, kind of do some science on this and then give feedback to them. Yeah, please.
AARP membership begins at 55.
Is it 55? I thought it was 50, I think I got my first invitation card to
Can you
join.
clarify what the AARP is, just in case people don't know what that is?
Yeah, so has everybody heard of AARP? It used to be called the American Association of Retired Persons, I believe. They then shortened their name to just AARP, so you're not supposed to say American Association of Retired Persons. It's just strictly AARP. They are AARP. But more recently, they're now calling themselves AARP, American Association of Real Possibilities. I don't know if you've heard that newer take on AARP. But anyway, so I think yes.
I just wanted to note that between 55 and 96, which is a lifespan that more and more people are achieving.
Absolutely.
There are vast differences. It's like saying adults.
Yeah.
So when we talk about older citizens or older people, we are really talking about half the population.
At least.
And they are, for many decades of that period, indistinguishable from the dominant working population.
Right. And are still the biggest part of the dominant working population.
So they aren't an objective discourse. They are us.
Mm-hmm. Right. Yeah, so I thought it actually started at 50, and I feel like I got my first invitation at 39 or something. But it's kind of
post-teenager.
Yeah, exactly, right. And I kind of think, geez, I'm over 50, but I certainly don't feel like I should be part of an older adults group because I don't even feel like I've reached middle age. Aren't we all kind of teenagers in our own minds, right? But it kind of speaks to the notion that age is a bit of a semantic, and we shouldn't necessarily be thinking just of age. And if you look at two 40-year-olds and you look at their health characteristics and kind of who they are, those two 40-year-olds are going to be much more similar to each other than two 80-year-olds. As we get older, there's more variability in our adaptability, there's more variability in our health status, there's more variability in our mental capacities. And it's really important to remember that as we think about what happens with our aging populations. We can't think of our aging population as a homogeneous population. We're incredibly different. I mean, I know people who are running marathons at 85. There are people at 30 who don't have the capacity to run a marathon, right? So there's so many, it's such an intricate thing. And I have 96, I have 98-year-olds who are sending me messages on our secure portal. They are totally wired. They are, they're sending me information. They've been, reading and researching, and they're completely connected and very brilliant people. And I also have, 70-year-olds who don't have a computer, don't want to learn to use one, just have a very different take on how they think about technology. So I think we need to be prepared to think about all of the different levels of engagement around some of these newer things like technology. And it's something we should never stereotype people in thinking, that guy's 94, he's probably not using a computer, or he's probably not walking 5 miles a day, or he's probably, we kind of stereotype people as they get older into thinking that they're not doing these things anymore, when in reality they may very much be doing all of them yet. and acting like a much younger person. Oh, by the way, we only got a 27 in environment, which I find a little bit amazing because clean air, and I mean, I think we have lots of parks and clean air and things like that, so I'm not quite sure how we got a 27 in that area. Maybe that's the feedback we need to give to AARP, that we like, our environment's really not all that bad. Okay, so this is just a model that we've been putting together. It's just a start, just a draft of kind of thinking about how to connect healthcare and community, and thinking about thinking from a perspective that, you know, we are an academic medical center. We're training the physicians, the nurses, the physician assistants, the pharmacists. We're training the health professionals of the future. And if we're going to train our teams to thrive in an aging world, we really need to be thinking from a very broad perspective. And so, you know, some of the categories that I think from and that I like to use are kind of this lifestyle wellness and your ability to kind of continue to be successful in aging well, even if you've got some diseases or problems like this. Community engagement, age-friendly workspace. I think this is another growing thing. You know, I talk about age-friendly cities, age-friendly health systems. Have people heard about age-friendly workplace or age-friendly workspace? Is that a concept that people are aware of yet? So this notion that older adults oftentimes want to stay in the workforce, and honestly, many older adults need to stay in the workforce because, you know, they can't afford to retire. And thinking about the fact that most workplaces are designed for young, healthy people, and they're not designed for older adults. And what can we do to encourage workplaces to become more age-friendly? There's a really neat documentary called Coming of Age in an Aging America. I don't know if anyone's seen that yet. It's just been out for maybe a little over a year. But it has some really nice stories about how to make workspaces friendly. And can I take a minute to tell us one of these stories?
We're actually...
Are we over already?
I'm conscious of time, so
okay.
Maybe hold on that.
Okay, yep. All right. So these are just kind of some thoughts about how to engage around that. And then values. So again, age-friendly is an equity filter for all city policies and practices. I think that was a nice statement also that came out of the mayor's office. But these are the values that we put forward for an age-friendly community. And I had to put this, I was just traveling in Sweden and Denmark. Can you tell what this is, what she's wearing?
Bike helmet.
It's a bike helmet. So, you know, a lot of people don't like to wear helmets. It goes around your neck, and it's just this, you know, kind of circle. It's small. It doesn't really look much like anything. But if you accelerate in a fall, it puts this whole, you know, beautiful soft cushion around your head to protect you as you fall. So you don't have to wear it as a helmet. So I looked at it and I said, oh, we need to get one of these for hip fracture. And people would just wear it as a belt. But if they accelerate and go to ground, it will explode like an airbag and be around their hips and protect from hip fracture. So if anybody here is an entrepreneur and wants to develop this idea with me, let me know. But anyway, I thought it was pretty cool. Oops. Oh my goodness, what happened here? We already talked a little bit about architecture. Thomas brought it up, but this is a kind of a newer model that's developing in Portland. I think I need to hear the story from the back of the room because it sounds like you guys are doing some pretty cool stuff architecturally as well. But just on kind of trying to make buildings more friendly. And then okay, well, I guess it's telling me I'm done too. I just love this quote. We do not quit playing because we grow old. We grow old because we quit playing. I think, you know, that's a nice motto for us to have as we age ourselves. And then just my last slide, which, wow, I'm not going to show these other slides. I just wanted to make you aware of some of the places at OHSU that are thinking about this. We have Aging and Alzheimer's Center at OHSU. Orchitect is it's a Roybal Center. It's funded by the National Institutes on Aging around aging and technology. It's a really great place. We have a School of Nursing Center on Gerontological Excellence, and then our OHSU Brain Institute does some of this as well. And then I've been part of the OHSU Healthy Aging Alliance for the last 8 years, maybe 9 years, and we also are trying to work together on translational science, moving aging, geroscience, aging innovations out into the community as rapidly as possible. So these are some of the resources that are available through the groups that I work with as some possible places. And I will stop there. Should we have any questions now, or should we wait until after the next presentation?
We're almost at 10 already, so it may be better to have David and I do our things.
Perfect. All right, I'll turn it over. Are you next? Whoever's next.
Yeah, David's going to come up.
Okay.
Thank you very much.
Well, I'm excited to be here today. Thanks so much for coming out. My name is David Cohen. I'm interim executive director of an organization called the Intertwined Alliance. This intertwined story is a really big, complex story. Our health and equity work is a big, complex story. I'm going to just be incredibly brief, and maybe some more things can come out as we talk and have a Q&A session. The oops, we're moving.
Is it playing on
Yeah, it's playing automatically. So the idea of the Intertwined Alliance and the vision.
Let's see if you could just advance that plan.
That's fine. I think so. This idea is really based on what we generally would call collective action. We looked around the country. We thought about how big, complex problems got solved. There was always a coalition of groups, public, private, nonprofit, that came together to do something big. We looked around for models. We didn't see really models of this work, and we said, well, what if we built a coalition and kept it together instead of having to reinvent it every time a big problem came up. And so the Intertwined Alliance is based on also this vision of, our kind of main interest and goal is thinking about the importance of nature to cities, and how there's been a huge disconnect as we build our cities, that nature is getting shut out, and the concern that we're not getting the value of nature in our cities. Portland's a very nature-rich city in general, but there are still incredible challenges and complications, especially in the issues around equity. There's also this notion of biophilic cities that I'm sure many of you have heard of. Biophilia is this notion that human beings in our million years of history on the planet have been connected to nature. It's only in this little time period in the last 500,000 years, 100,000 years, and 5,000 years that cities have been built, and we've been kind of disconnecting ourselves to cities. And so this whole notion that of biophilia, that it's really in our DNA to be connected to nature, is now kind of started this movement, the notion of biophilic cities, that we need to make sure as we're building our cities that nature is part of it, and that again we're receiving the benefits of nature. The Alliance's sort of bottom line is, that we need nature to have, nature needs to thrive in our cities for us to be really healthy. We're designing our community spaces to actually disincentivize physical activity and access to nature. Environmental and recreational issues are not perceived at the same level of urgency as other community issues when parks, bonds try to get passed, and we try to do things to create investments in nature. Things like housing, things like transportation seem to become, and health are kind of outweigh those, and so nature is sort of a nice to have instead of a must have. And then of course there are barriers, real and perceived. In terms of access, we think, of course, a place like Portland, nature is everywhere, we can all access it, but it's not really true. There are barriers and issues that really get to our kind of equity problems. So again, the organization was created to say we've got to do business in a different way. And because the way we've been doing this is we're actually losing ground. We're not solving our problems. The problems are getting worse. So how can we behave differently? to get this work done. And so we created an organization with these sort of basic tenets about being the holder of the regional vision. Who's really holds the regional vision? And there are cities, and we have actually 28 different jurisdictions in our Portland metro region. Who holds the vision for the region? And so the individual cities can do their thing, but is there a regional vision that needs to be front and center? And how do we build collaborative efforts? Collaboration is not natural. It actually takes work. It takes intention. We're a world of silos. We do work because we're so busy and our noses to the ground, often doing our work. The thought of working with other groups is we're very challenged to do that. And so, whose job is it to nurture collaborative efforts? And again, we've kind of taken that on. Also, this notion of engaging non-traditional partners. Of course, we started out as an organization of environmental groups, parks districts, city bureaus that dealt with the environment, but we know that the issues are bigger than that. How do we include other groups in this conversation, especially the environmental community? We've been incredibly segregated from the rest of the world, and that's been kind of part of the problem that we're facing. So how do we make the connections to other groups? How do we make other groups own our issues and want to participate and play with us in the sandbox, so to speak? And then again, being a convener and a connector, and that's really the Intertwined Alliance. That's really all we do. We are a neutral convener. So we put people in a room together. We create platforms for conversations. We have conversations about everything imaginable, and we find a common ground that our partners want to work on and think about. Just a few basics. We were launched as an idea in 2007, actually incorporated in 2011. So we're still a toddler in many ways. We're tiny. We only have 4 FTEs, but we have now 164 public, private, and nonprofit partners, and we are primarily funded by the partners. So this is a model that is kind of new and different. Other cities are calling us who want to do this work, and because we do have to, again, think regionally about solving our problems. Our scope is huge, so we're not just about the environment, we're just not about conservation. We see the connection between all of these things. And again, this gets back to the siloing. Each of these is their own silos. So how do we get beyond these silos? If we're just about conservation, sure, we can talk amongst ourselves and talk about conservation, but conservation and active transportation, health even, is all connected. All of this is connected. So who's connecting the dots? Whose job is it to connect the dots? And so in a way, we've taken this on, and it's impossible. It's an impossible task. But I'll just touch on a couple things that again might be of interest to your group or your groups, and that is we have really centered equity in this work. We've realized a bunch of things that we do in the environmental community, especially. We do an incredible job of preaching to the choir. We've got a great choir, especially in Portland, Oregon. Other cities would love to have the choir we've got here, but that's not what success looks like. Success really looks like when everybody's in the choir. So how do we do that? How do we talk to folks outside? All the things that are happening nationally now with the distrust of the climate change movement and scientists. I think it has a lot to do with the fact that we haven't been just preaching to the choir, and so we haven't learned to even talk about our issues in ways that folks outside our movement can really understand, relate to, resonate with. Certain people and groups felt left out of the movement. The environmental movement basically started in the 70s was a very white middle-class movement. And so from the very get-go, we were founded, and even going back to the institution of the national park system, a very white, dominant male culture kind of efforts. And so how do we start to look at the work we're doing in a different way and make it feel more inclusive? The notion that there are barriers out there that are kind of invisible barriers that we don't even think about. Folks going to parks, making our parks safe, our natural areas safe, and this notion of folks not seeing people like themselves in those places. We wonder why folks in communities of color are not signing up for classes, let's say, or our volunteering at a later age, or our volunteer population that's supporting parks and natural areas conservation is also a very white, elderly population of retirees. How come that's not a diverse population? And so we realized, and then the workforce, like I say, we have the folks who work in the environmental sector and in the park sector, incredibly white centric. And so how come that is? How do we get here? How do we dismantle that? How do we look at it differently? Well, maybe go back. So we have trying to tackle this in a lot of different ways. We're really dealing with issues around actually institutional racism within the environmental sector. We've got a cohort program we put together that helps organizations go through trainings to think about, assess their own programs and how that all works. So again, how do we make these spaces feel like true public spaces instead of, again, that maybe it's somebody else's space. And this really has a lot to do with how we're designing our communities, how we think about the way we shape our programs, the way we welcome people into spaces, all has to do with this kind of thought, with kind of these issues. I'll talk briefly too about this health and nature work, and going back to the Jeffrey Donovan slide earlier, and the research that's coming out now that shows the health benefits of nature. You know, this was sort of a light bulb that happened late for us in a way. A number of years as we were developing this, we didn't really talk about health a lot in the beginning, although a group like Kaiser Permanente was one of our founding partners, and so they got it even before we did. This notion that there is all this research out there that is in the last 10 years is just proliferating like crazy, that shows the health benefits of nature. We all sort of intuitively knew that. We know going outside, breathing fresh air, drinking clean water, all good things. But it was just sort of intuitive. Now, in the last 10 years, there is so much research. And we said, oh my God, how come we're not doing something about this research? Why are we talking about this? Why are we putting it in front and center? And so that leveraging that research is critical. Can we as an organization, again, what can we do as a coalition that individual organizations can't do? Could we put this research front and center? Could we get it out there so people are thinking about it, talking about it, prioritizing it in a more leveraged way? Could this conversation about health, could framing environmental issues with a health framework start to create a level of relevancy and urgency for this work? Once we start, even again, Jeffrey Donovan's work and folks like that, once we start talking about tree canopy and things like asthma rates, you know, like and there are now research that show more tree canopy, lower asthma rates. If we start talking about we need trees in terms of community health, does that start to make it feel like, oh my gosh, investing in trees is a lot less expensive than some of the other ways we are going about thinking about improving our communities and overall health. So this connection to health, we're very excited to think about that tree planting, for instance, is just not a feel-good thing. It's actually a health outcome response. And health sector is a funding source. So this is, again, the environmental bucket of money, tiny little bit of money. We fight over the scraps, to kind of do amazing work, but it's all totally underfunded. The health sector bucket, big bucket of money. And for pocket change, in my mind, of what they're working on, and as they go through their own questioning about how to solve some bigger problems around the social determinants of health, other things outside of your DNA that really impact your health. Could they see investments in our healthy communities, in our natural areas, natural spaces, green infrastructure, as ways to actually solve the health problems that they're working on? And so we see that there's enormous potential there. And so out of these health and nature conversations, And again, the way the Alliance works, we put people in a room and we start talking. We have no idea where it's all going to go. We've actually developed a couple of projects. One is called RX Play, where doctors are actually going to be writing prescriptions to get people out and connected to nature. There's a national movement called the Parks Prescription Movement. About 35 of these projects exist around the country. Ours is a little bit different because in Portland we have to do things differently. And the scale of it is going to be something that is unprecedented. No one's attempted to connect multiple healthcare institutions, multiple physical activity providers to create a system. We're about 6 months to a year for launching that program. And then this Greening of Schoolyards project. The idea, we're very interested in of course, getting kids and families to nature, but what if we brought nature to the kids? And so we see this also as a health project that we could, again, make healthier schoolyards and make these spaces, community spaces, that were actually places of health, school gardens, nature play. There's a whole national movement around green schoolyards, and so we're trying to actually build a collective of all the groups working in that sphere to see if we can do more advocacy and get more funding for those projects. So just a real snapshot of some of the things we're doing, but again, just a sort of a different approach to how we're looking at our problems and being that neutral convener that can bring sort of different folks to the table, where the health work is exciting because, and equity work, and the two are so tied together. We say also health and equity, we don't separate them in a way. It's really critical to the success of our work. But again, what we're trying to do is ultimately foster a different paradigm of the way we work out in the world. And can we, and again, whose job is it to bring people together? There are some wonderful collaborators out there, good partnerships. I'm sure all of you work in partnership with others, but it's hard work. It takes a lot, and so philosophically, we're at a place where we say you need that third party to kind of keep some of these things going. The momentum for shared projects sometimes dissipates over time. Small guys feel like it's the big guy's project, and it's not our project anymore. Or the big guy moves on to other things, and they don't want to, and they've got other interests. So whose job is it to get these kinds of things going? And so it is the work we're doing. It's still in a way in its infancy. But like I say, lots of other cities are now starting to do this. We get calls regularly from other folks who want to think about how do we put something like this together. So very exciting work, but like I say, we are learning constantly, and we've not really figured this all out, but willing to, as we go through some Q&A, talk a little bit more about any of these ideas. Thanks.
All right, if you're up for it, we have one more content piece here before we move into more general discussion. Why don't you just take a moment? We've been talking about some pretty high-level, interesting ideas, but I'd like you just to think for a second. I'm gonna switch gears a bit and talk about not so much what we're thinking about, but how we think about it. Like, what's our own psychologies? So I'd like you to just for a moment think about when you think about your own personal relationship with nature, however way you might.
Do you use the mic?
You want me to use the mic? Sure. If you think about your own personal connection with nature or the natural world, in whatever way that you want to conceive of that, see if you can think about one or two key moments in your life that influence your sense of connection with nature. Think about your lifespan, childhood, current life. See if what pops into mind as a determining factor for you in terms of your relationship with nature. What pops into your mind? Is it a place that you went to? Is it someplace where you're from? A place where you grew up? Is it a mentor? Is it an event? Right? people have these things in their mind. Sometimes you're not prompted, you don't think about it, but when you're prompted to, it's sort of right there, right? So that gives you a flavor of what I'm going to talk about in a few minutes. Is this idea of our environmental identity. It's how we think about nature and the natural world. And then we'll do the same thing around technology, because we could also think about our salient experiences with technology in our lives. You know, what leads us to feel certain ways about technology. Right? Similar kind of idea. Could be a mentor, could be an experience, could be where we're from, things like that. So this is the idea about the point of this component is how do we think about how people think about these things in terms of smart cities, health, healthy aging, and things like that. So we can work with people, and so we can craft messages, and so we can bring these ideas along. Just some big picture ideas about nature and health. Right? When we talk about nature, nature is a big term, but when we think about nature, what we're really meaning is a continuum from indoor nature, plants in our buildings, images of nature, art images of nature, virtual images of nature, to nearby nature, which is parks and gardens and green spaces, to what we would call managed nature, like state forests and things like that, and to wilderness areas. So there's a whole spectrum here. You know, we're in that end, the virtual end. There's no, right in this room right now, in the convention center, we're in sort of indoor nature to the max, right? I've often joked about bringing a little plant in if I do a talk in the convention. There's not a lot of living nature here. But when we're thinking about people's connections with nature, we're thinking about how does it work on this whole spectrum, right? And that's how you start to think about the health interventions and what's fitting for a person. And a way to think about that, a nice model that I like is called the nature pyramid. It's kind of like the old-fashioned food pyramid in the sense that there are certain connections with nature that you'd like to have a lot of. Hopefully they're easier to have and they form the base, and then there are maybe more rarer connections, right? So we might think about your daily connections with nature in the outdoors in your neighborhood, and then maybe weekly or occasional forays into other areas, regional areas, going to the ocean, going up to the mountains, going out to a park that you like, and then there might be a monthly or yearly kind of activities, depending on your social placement and your ability, where you might travel somewhere and see some things. People might have very important life goals of visiting a certain place or doing a certain activity and things like that. The key is getting this pyramid flowing. And so a good question is, how can we create a smart city that has a nice nature pyramid idea built within it that is accessible to different people across the lifespan? So I think the nature pyramid would plug into the smart city. And so environmental identity, again, I won't spend too much time on it, but if we had a longer day-long workshop, we could spend a lot of time with people really unpacking the building blocks of their individual environmental identity, their basic values about nature, their experiences. Could be positive experiences, could be negative experiences. Very, very different based on your social placement, where you grew up, things like that. There are 3 core values that people have regarding nature. This is more of the basic science stuff, but it's helpful to know because it translates into a lot of areas. People either value nature conservation for egoistic reasons, because it's what's in it for them, right? For their personal health, for their family, for their loved ones. That's a big determinant of why someone would want to protect nature or the natural world. Then people also have altruistic goals in the sense of what is it? How do I help other people? How do I help the community, right? And then people also have biocentric goals, which would be what is the rights of nature itself and other species, and how do I protect them? And all of you have your unique profile in this regard. And there's no right or wrong answers here, but certain people may come in from an animal-centric place, other people may come in from more self-centered, other people more altruistic. And this kind of translates to a lot of engagement and a lot of social equity, environmental activities. There's a lot of info here, but I want to touch on it because people have certain values about nature and animals, And I think it's helpful to know because I think it's similar to the values that people have about the technology, right? In the United States, people have values, and when we studied people's values regarding nature and animals, some people value the natural world for aesthetic reasons, for the beauty. Some people like to control the force of nature. Other people have scientific interests. Some people have a personal relationship with a place or other animals. Some people have moral values, right? There are these different kinds of values. Some people have negative values, symbolic values, right? In the United States, we tend to rank, our primary connection with specific animals and places and moral values, such as not harming animals and things like that. But in the United States, a lot of people have negative values around nature and obviously utilitarian values about nature. Like what is in it for us as a society, right? The scientific tends to be less popular among the broad people in society, right? So we have to be careful when we're working with people. We have to connect with them on what they love and what they care about. If we just start with the science and with the data, we'll often miss people, right? And so I sense that these kind of moral values also translate into technology. Certain people really get excited about technology because they're into the science of it. Some people think it's really cool and beautiful and exciting. Other people have a aversive sense about technology. So it's interesting. So why smart cities? Well, the point of why we're having this talk is that smart cities can help create a better quality of life through all kinds of efficiencies, all sorts of technologies and things like this. They potentially could break down some barriers in terms of access to green spaces and nature and things like that, right? Now with technology, we have to be aware of some things though. Again, there's some psychology here, but there are certain factors associated with why someone would want to take up a new technology or not, right? If someone has an affinity or an interest in that technology, that's an obvious one. But there are other things that people have to demonstrate. They have to have a tolerance for ambiguity, right? They have to be able to be okay with different, unfamiliar things. They have to have an optimistic sense about why we would use technology. If someone is more optimistic about the world, they're more likely to see technology as a benign or a positive force. It also depends on the person's locus of control. Do they feel like they have control over the technology or not? For certain people, if it's beyond their control, it's going to be off-putting to them. And then there's what in psychology they call higher low cognitive styles. That means, how much do you like to think about things? If you really like to think and problem solve, you might really be interested in new technology. But if you're someone who's got a low thinking preference where you just want something to work or not, then you don't have the tolerance to take on a new technology. And then there's self-efficacy in the sense of, do I feel confident about this? Right? And then there's also age and gender, different factors. I was visiting back east recently where I grew up, and I took my mother, who's age 75, to a medical appointment. And the clinic where she went had replaced the front desk person with a screen, a little touch screen. And so I had taken her to this place before, so I knew about it. So I was able to figure out quickly the touch screen. It took me a few minutes, but I could put in her name and her birth date. We could find her appointment. And we sat down. And then my daughter, who was with me, age 10, and Grandma, she's number 10 in line. And I said, well, how do you know that? She said, well, there's a screen on the wall, and it says her name up there, number 10. And I said, oh, okay, I hadn't noticed that there was a screen up there. So, but she, as a young person, she's actually noticing things in the environment, right? Well, we navigated a new tech area, right? But then an older person came in after us, an older man, and he struggled with this. He had not been in with this screen interface before. He struggled with it. He said loudly, he said, oh, that's life in the big city. They took away the real person. He couldn't figure it out. He got very angry with it. He took the stylus pen and started jamming it into the thing really loudly, kind of disturbed everyone, and then just sat down and said, well, I guess they'll come and find me. Right? So it was really interesting to see, for this person, in that particular moment, he did not see this as a benign or positive thing. He didn't have a good locus of his own personal control or self-efficacy and things like that. So it was just a good example of how things can, a well-meaning intervention that may be efficient in some ways could really not work. So this gets at some of the barriers that can happen with adopting new technologies. And then I'll skip on to this, but there are different ways that people plug in with technology. And then, so what are some solutions? And this is where we get into our big talk. When I first thought about this talk, and we were planning this, there was this idea of, well, maybe we can have high-tech, low-tech, and no-tech solutions for a smart city. Maybe some part of the smart city is really this high-dollar, high-technology stuff. But what about people-centered approaches? What about using grassroots organizations that already exist? And what about no-tech sources of health? What about just letting nature be nature? And let's try to get the tech and the screens away. So how do we balance this? Maybe that's a direction going forward. And then there are different examples. If you've been here in the last couple of days, there's been a lot of neat ideas, a lot of different engagement platforms. A person yesterday talked about the Smart Lamppost, Hello Lamppost program, where the actual lampposts in the cities have a little recording where you can speak to them and you could tell stories, and they capture people's stories in neighborhoods and things like that. There's various health dashboards, like Elizabeth has shared. Stan, you were talking yesterday in your talk about wellness communities and this idea of complete neighborhoods that have green spaces, that have stores, that have medical, that have walkability. I know the talk yesterday talked about regenerative urbanism that really takes this eco movement to a very deep level in terms of just even how the electricity and the sewers and the water all work together. Yesterday we also talked a bit about this Right to Root, a grassroots kind of anti-poverty development plan. So there's a lot of different things flowing here. And then again, I think for Oregon and Portland, I think we do want to think about the state and how do we connect people across the state and also connect people within the city. And I think these areas, this kind of east-west divide and the city divide is pretty common in a lot of places in the United States. If we have time later, if we do some small group stuff, I'll demonstrate. An exercise I've used with help people talk about their feelings about environmental issues is just having two globes, kind of a red flaming globe and a blue globe, and it helps them to speak about their fears and concerns about a topic, and also their hopes and dreams. So I think ultimately here we're dealing with people's fears and concerns and hopes and dreams. And how do you get that? How do you get that on the table? If we can get people talking about that, then I think we're going to get some. That's what I have. So it's time for a little chatting. We've got, we're just near to 10:30, so I understand that people need to move on, but we do have some time here for a larger discussion. We have this room for a while. So I thought we'd open it up for a bit of discussion and then see where people are at for maybe sticking around longer. Okay. Thoughts? Yes, go ahead.
I just wanted to share two observations on the story of the man coming in holding a screen.
Yeah.
First of all, that because we live in a multi-generational society, as you pointed out, between the daughter and the elderly man,
Yeah.
there is a vast difference in competency with introduced technology. Secondly, all the technology we use is interim technology. I mean, what happens if he had walked in 5 years later and he was 5 years older, and instead of having to work with a machine, a voice would have said to him, now, what are you doing and what can I do for you and how will you do it? He might have had no problems. So I think when we think of technology, we can't think of a fixed point. We have to think of it as a fluid, evolving set of conditions whose problems and changes differently affect the multiple generations simultaneously growing up with it and living with it.
Very well said, yeah. Thank you. Any thoughts about how to integrate this idea of lifespan, nature, people's psychology, and what's happening in people's work?
I'd love to, hear